Care of the newborn number 3. Handle the newborn carefully and monitor for any bruising or bleeding episodes. Watch for meconium stool and subsequent stools. Administer intramuscular dose of vitamin K to the newborn as prescribed to prevent hemorrhagic disorders. Usually 0.5 to 1 mg is prescribed. Administer in lateral aspect of the middle third of the vagus lateralis muscle. Remember, administer intramuscular dose of vitamin K to the newborn as prescribed to prevent hemorrhagic disorder. Usually 0.5 to 1 mg is prescribed. Administer in lateral aspect of the middle third of the vastus lateralis muscle. Vastus lateralis muscle. Assess the newborn's hemoglobin and blood glucose levels. Assessment for renal system. The immature kidneys are unable to concentrate urine. A weight loss of 5 to 10% during the first week of life occurs as a result of water loss and limited intake. Birth weight should be regained by 10 to 14 days after birth. Weigh the newborn daily. Monitor intake and output. Weigh diapers if necessary. Remember, 1 gram of diaper weight equals 1 ml of urine. Remember, 1 gram of diaper weight equals 1 ml of urine. If the diaper requires weighing, record the weight before putting it on the newborn. After the newborn voids, reweigh the diaper and subtract the pre-voided weight. Assess for signs of dehydration. Assess for signs of dehydration, such as dry mucous membranes, sunken eyeballs, poor skin turgor, and sunken fontanelles. Immune system. Newborn receives passive immunity via the placenta. This is called immunoglobulin G. Newborn receives passive immunity from colostrum. This is called immunoglobulin A. Elevations in immunoglobulin M indicate infection in utero. Use aseptic technique and standard precautions when caring for the newborn. Ensure meticulous hand washing. Ensure that an infection-free staff cares for the newborn. Monitor the newborn's temperature. Observe for any cracks or openings in the skin. Administer eye medication within 1 hour after birth to prevent ophthalmia neonatorum. Administer eye medication within 1 hour after birth to prevent ophthalmia neonatorum. Agent use varies depending on agency protocols, but usually ophthalmic forms of erythromycin 0.5% or tetracycline 1% are prescribed because they are bacteriostatic and bactericidal and provide prophylaxis against Neisseria, gonorrhea, and chlamydia trachomatis. Administer eye medication within 1 hour after birth to prevent ophthalmia neonatorum. Agent use varies depending on agency protocols, but usually ophthalmic forms of erythromycin 0.5% and tetracycline 1% are prescribed because they are bacteriostatic and bactericidal and provide prophylaxis against Neisseria, gonorrhea, and chlamydia trachomatis. Provide cord care. Umbilical clamp can be removed after 24 hours if cord is dried and occluded and is not bleeding. Remember, umbilical clamp can be removed after 24 hours if only if cord is dried and occluded and is not bleeding. Teach the mother how to perform cord care. Keep the cord clean and dry. Soap and water may be prescribed for cleaning the cord. Keep the diaper from covering the cord. Fold the diaper below the cord. Assess cord for odor, swelling, and discharge. The newborn is washed via sponge bath until the cord falls off within 2 weeks. The newborn is washed via sponge bath until the cord falls off within 2 weeks. Provides circumcision care. Apply petroleum jelly gauze to the penis except when a plastibell is used. Remove petroleum jelly gauze if applied after the first voiding following circumcision. Observe for swelling, infection, or bleeding from the circumcision site. Teach the mother how to care for the circumcision site. Clean the penis after each voiding by squeezing warm water over the penis. A milky covering over the glans penis is normal and should not be disrupted. Monitor for urinary retention. Monitor for metabolic system and gastrointestinal system. Newborns are able to digest simple carbohydrates but are unable to digest fats because of the lack of lipase. Remember, newborns are able to digest simple carbohydrates but are unable to digest fats because of the lack of lipase. Proteins may be broken down only partially, so they may serve as antigens and provoke an allergic reaction. The newborn has a small stomach capacity, about 90 ml. With rapid intestinal peristalsis, bowel emptying time is 2.5 to 3 hours. Breastfeeding usually can begin immediately after birth. Based on doctor's preference and agency protocols, bottle-fed newborns may be initially offered no more than 30 ml of formula. Remember, breastfeeding usually can begin immediately after birth. Based on doctor's preference and agency protocols, bottle-fed newborns may be initially offered no more than 30 ml of formula. Observe feeding reflexes such as rooting, sucking, and swallowing. Assist the mother with breastfeeding or formula feeding. Breastfeeding should be done every 2 to 3 hours, and formula feeding, maximum of 30 ml or 1 ounce, should be done every 3 to 4 hours, as of doctor's preference or agency protocol. Assist the mother with breastfeeding or formula feeding. Breastfeeding should be done every 2 to 3 hours, and formula feeding, minimum of 30 ml or 1 ounce, should be done every 3 to 4 hours, or doctor's preference or agency protocols. Burp the newborn during and after feeding. Assess for regurgitation or vomiting. Position the newborn on the right side after feeding. However, the side lying position is not recommended for sleep because this position makes it easy for the newborn to roll to the prone position. Prone position is contraindicated because the prone position increases the risk for sudden infant death syndrome. Observe for normal stool and passage of meconium. Meconium stool is greenish black with a thick, sticky, tar-like consistency. Usually is passed within the first 24 hours of life. Transitional stool. The second type of stool excreted by the newborn is greenish brown and of looser consistency than meconium. Seedy yellow stools are usually noted in breastfed newborns. Pale yellow to light brown stools are usually seen in formula-fed newborns. Perform a newborn screening test, including the test for phenylketonuria, as prescribed before discharge after sufficient protein intake occurs. The newborn should be on formula or breast milk for 24 hours before screening. Perform a newborn screening test, including the test for phenylketonuria, as prescribed before discharge after sufficient protein intake occurs. The newborn should be on formula or breast milk for 24 hours before screening. Assessment for neurological system. Newborn head is proportionally larger than of an adult because of cephalocaudal development. Myelinization of nerve fibers is incomplete, so primitive reflexes are present. Myelinization of nerve fibers is incomplete, so primitive reflexes are present. Fontanelles are open to allow for brain growth. Assess for abnormal head size and a bulging or depressed anterior fontanelle. Measure and grasp the head circumference in relation to chest circumference and length. Assess the newborn's movement, noting symmetry, posture, and abnormal movement. Observe for jitteriness, marked tremors, and seizures. Test the newborn's reflexes. Assess for lethargy. Assess pitch of cry. Thermal regulatory system. Prevent cold stress. Cold stress causes oxygen consumption and energy to be diverted from maintaining normal brain cell function and cardiac function, resulting in serious metabolic and physiological condition. Cold stress causes oxygen consumption and energy to be diverted from maintaining normal brain cell function and cardiac function, resulting in serious metabolic and physiological condition. Newborns do not shiver to produce heat. Remember, newborns do not shiver to produce heat. Newborns have brown fat deposits which produce heat. Prevent heat loss resulting from evaporation by keeping the newborn dry and well wrapped with a blanket. Prevent heat loss resulting from radiation by keeping the newborn away from cold objects and outside walls. Prevent heat loss resulting from convection by shielding the newborn from drafts. Prevent heat loss resulting from conduction by performing all treatments on a warm, padded surface. Keep the room temperature warm. Take the newborn's auxiliary temperature every hour for the first